Hi everyone, Misty here. Today is July 30th, 2026. I am chemo cycle 5, day 2. So I went in 2 days ago for my pre-treatment blood work and everything looked good except for my iron. Well, good enough except for my iron. I have had 4 iron transfusions and my iron has not come up at all. So I have to contact them next week to do either request an iron infusion based on that blood work or ask for another blood draw and have my iron tested again, because it was only a week after the last iron infusion that they did the blood draw and tested it. So they may want to do another test because that is pretty quick after the infusion. I'm pretty pink tonight. I'm very, very tired. I've had a busy few days and the fatigue is just getting more and more and more. They say that the side effects from all these chemo drugs are cumulative, so they just keep piling on the more cycles you go through. But I don't know, the fatigue isn't fun, but it's tolerable. I would much rather have fatigue than the nausea and vomiting that some other people have. Yesterday I started a new chemo drug. This one has some different side effects. It does have hair loss as a side effect, so the little bit of short hairs that I have up here, you can't really even see them in the camera today. I got a little bit of peach fuzz, a little bit of porcupine hair up there. It's hard to say whether that'll get affected and fall out, but oh well, it doesn't really matter. It's temporary, so it'll grow back, I'm sure, and if not, I'll find a workaround. It's just hair. A lot more other important things. Yeah, so with the new drug yesterday, I was pretty worried about having an allergic reaction during my first infusion. So they pumped me full of 2 types of allergy medicine and an anti-nausea medicine. The infusion took an hour for pre-treatment medicine. And then, oh man, I was barely through getting my Benadryl infusion and I was ready to sleep. I was fighting to stay awake. But I needed to stay awake so that they could do the safety procedures before giving the chemo medicine, and you have to verify who you are as a patient with your name and birthday. If they can't verify it, they can't just set it up while you're sleeping. Even though I've been in there enough times that they know who I am, they still have to do the proper checks. Yeah, so Troy had dropped me off and went and did some errands around town, and he come back just before I was done those pre-meds. So he kept me awake long enough to get through all the safety measures and get set up, and he waited a few minutes to make sure that everything was going good, and then that part of the infusion, the actual chemo medicine, was another 3 hours plus a 20-minute flush after. So it was a long day. So he went home and did errands, or not errands, but chores or whatever. And I rested, I'd say, at least 2 hours of the 3 hours of the medicine, maybe even 2.5 hours. I did a little bit of playing around on my phone, but not that much, and I think I actually dozed off at least a couple of times while I was resting, but yeah, that Benadryl really wiped me out. But other than that, I had no side effects. I didn't get a rash, I didn't get all blotchy, I didn't have an anaphylactic reaction, my throat didn't swell, and my ears didn't have issues, and no, it was great. I'm very, very thankful for that. I was quite worried about it, although I had talked to the nurse and stuff about it, and I was feeling better about it from the appointment the day before, but I still was worried about it. First time is always scary. Yeah, so did that. I can't remember. Oh, the anti-nausea medicine that I usually took by pill on the other cycles. This one was through IV, and it's a stronger dose because I'm not on that really big one that they had for the other medicine. It's a very, very strong one. And this one, I think it's called dexamethasone. And no, it doesn't have any meth in it. I looked that up right away. It causes insomnia for me. So I end up with really bad fatigue and insomnia at the same time. How that can happen, it does not make sense at all, but I'm so tired I can't keep my eyes open, but I can't fall asleep. Yeah. So last night I did, after trying to go to sleep for a couple hours, I took melatonin, and I slept for about 3 hours, and then I was awake again, and I was awake for another hour or two, so I took some more melatonin, but then I was still awake at 5 o'clock this morning. So those are tough days when you're so stinking tired you just can't function, but you have insomnia, so you can't sleep. Yeah, it's tough. So today I had an appointment with my oncologist. She's the one overseeing my case. And I told her about the insomnia and fatigue combination. And she said, well, if you're not having nausea, and I have been very lucky so far on this. I forgot to take that dexamethasone after my last cycle. I was really busy and totally forgot until the day that I was supposed to be stopping, so I didn't bother. But I had Googled it more, and I thought, oh, I better make sure to take it because it helps prevent allergic reactions and some other stuff. So I was trying to be on it this time. But she told me that if I wasn't having any nausea issues, that I could just not take it. And at first she said, don't take the bedtime dose. And then she said, if I'm doing good, just don't take it at all. So I do have a PRN as needed nausea medicine, and I have ginger chews. So they can be my backup plan without taking this Dexy. So that's what I'm going to give it a try. I didn't take any today because I talked to her before I took my first dose, and I couldn't nap today still, so the insomnia is still happening from my last night dose. But I have a lot of other information from the oncologist. I'm just going to grab my note. So she tried to book my appointment so that it was before my 5th cycle with the new medicine so we could go over that. And she was like, oh, well, darn, I guess that didn't work out right. But I said, well, I'd still like to hear what she has to say about it because I wouldn't know if I missed any information and what questions to ask if they hadn't told me at our cancer clinic. So she went through it all, and she said I can possibly get a rash in a week or two, so I have to watch for that. And then told me what to do about it if it does happen. I can get aches and pains. That can be anywhere. It can be soft tissue or bones. And she told me what to do about that. I could end up with a pain when I urinate, and if it lasts for more than one day, she told me I need to go in because it probably progressed into a UTI. I've never had one before. If I did, it was something that my immune system took care of itself, but I don't think I've ever really had pain urinating, so I'm sure if it does happen, I'll probably notice it right away. Then she got into talking about the neuropathy, and I think it's already starting. I noticed it a bit yesterday, but I also was having issues with blisters on my feet and soreness under my heels, which I do believe is called hand and foot syndrome. So when my feet were bothering me yesterday, I was just chalking it up to too much walking and it being the hand and foot syndrome. Well, today I am noticing it's in my hands also. When I touch something, like if I have to take a cap off something and twist it, it's like my skin stings from it. Some of the water bottles out there where you just about rip your skin open trying to open them, there's no way I will attempt to open something like that. It would just hurt way too much. And the bottoms of my feet, it's not the same soreness where I was having pain from the weight distribution on my pressure points. This is kind of like stinging just from my feet touching the floor. So I'm pretty sure it's the neuropathy. So I don't know. I have to do some more figuring out what to do about that, because I really don't want to be not able to walk. But I have some thoughts going on what I can do with that. And I'll be asking questions. I have built good relationships with quite a few of the nurses at the cancer care clinic where I live, and they're absolutely generous with answering any question I have. There's a couple of the nurses that are less chatty, so I will ask them if I don't have the other ones around that I can pick their brains. But they've all been really good. There's just a few that that seem way more informative, so they seem to be my go-to. And they're happy with that. They like the fact that I ask lots of questions, and I usually am pretty chipper. I wasn't really chipper yesterday. I'm beat, but I still have a positive attitude. I'm not chipper, I guess. I think I sound a little bit chipper in this video. I have a tendency to I don't know, mask, I guess, when I get chatting with people or around other people. I guess I've kind of trained myself to put on a happier composure than maybe what's really going on. Try to be a little chipper. So, I don't know, but I do find that exhausting, and I was too exhausted yesterday to to do more than I had to. But I'm still nice and good to them all, and vice versa. So anyways, when I was at the clinic for the pre-treatment, the doctor told me that I have an appointment with radiation for September 14th. So then when I talked to the oncologist today, she said that that one is actually the consultation, and my radiation won't start until October. They need to do the consultation, find out exactly what needs to be done and what protocol, and then they'll let me know. And there's a scan there that they have to do, a CT scan. I think it's called SIM or something. I have not looked it up yet. I will. I definitely will. That needs to be done the day of that consultation, and then it takes about 2 weeks from that for them to get the protocol all decided on, and then they'll get a starting date in October. So that's good. I sure would like to know how many weeks of radiation I'll have, and also I really want to get booked into the lodging facility that they have there. My understanding is they have support groups there and a whole bunch of stuff, and I have heard from a number of different sources that many people that go through this cancer stuff, they just live in survival mode through all of the treatments, and then once the treatments are done, it hits them what they've actually been through, and then they're on an emotional roller coaster or battle, because they're like, why is it hitting me now? I'm done all my treatments. So I think the support groups and stuff would be good for me. I have enough emotional stuff that I've been going through. My last number of years have been just one roller coaster after another, and I definitely would like to be in a place like that where I can utilize the support groups. There is a support group in my hometown, but it's a half-an-hour drive from home, and it's in the evenings, and it might seem kind of petty, but I just don't have the energy to go to it. And there's another fella that's going, and he's been putting stuff on social media and talking about it, and he went to the meeting, and he was just saying that everybody was so wonderful and supportive, and it's such a great group. And I bet you it is. I know the two ladies that run it. I know them on a personal basis, and I think it would be absolutely fantastic to go to, but I honestly just don't have the energy to do it right now. But maybe after I'm through the chemo, because that support group is for anybody that's affected with cancer. So it can be a loved one of a cancer patient, it can be during your cancer treatment, post-treatment, any association with cancer whatsoever. They are there to support, and that's absolutely wonderful. They're good people, as I said. So here's some awesome news. I got, because of my age and the type of cancer that it is, the oncotype testing determined that it's triple negative, and because I'm 50, which is young for that diagnosis, I was funded by the government to get genetic testing. And I didn't go through all the ins and outs for it, and I totally forgot to ask the oncologist if she could send the report. I forgot last time too, but I will get that eventually. But the good news is my genetic testing is normal. So I did not inherit this, and it's not something that I would pass on to my future generations, my kids and my grandkids. So that, yay, that's such good news. Oh, there's nothing worse than telling your kids and grandkids that, oh, I passed you on something that might make life more difficult for you. So that was awesome. There's a few things that are not so awesome that I found out or discussed more about at this oncology appointment. One is because there was 2 different diagnoses from the same tumor. They're basically treating me for both. So they're doing the chemotherapy and radiation for triple negative, but they're also going to do the estrogen blockers for the biomarkers that came back with a low amount of positive estrogen biomarker. So meaning that on those results, the estrogen feeds the cancer to grow. So they want to block the estrogen from feeding any potential cancer cells. So after my radiation is done, I will be on estrogen blockers for 5 years. So when they did my oncotype score before, it was 63, and that is really high. So that basically says that I have a high recurrence score, or percent, I suppose. So without surgery, it would have only been a matter of time until it metastasized to another part of my body and progressed to the point where I wouldn't have survived it. I don't know how long that would have taken. It could have taken months or years. I don't know. It wasn't something that I really got into because I've done the surgery, so I don't really feel that it's necessary to get those kind of details. And that could have been just kind of depressing. But the fact is, without the surgery, it wouldn't have been a good prognosis. So after the surgery was done, with my oncotype score and all the different calculations that they do, they have what the heck is it called? RS Clin tool, something like that, where they can put their information in and it gives them percentages. So because I have 2 different diagnoses on the same tumor, this tool doesn't really fit my situation. So this may not actually be accurate, but this is the closest they have for figuring it out. So if I opted out of chemo, my recurrence rate, so if I had surgery but no chemo, radiation, or estrogen blockers, my recurrence rate would have been 85%. That's very high. So how long it would take for it to come back, that specific cancer, it's hard to say how long. It could have been months or years. But at 85%, it's pretty much a guarantee that it would come back. I'm just trying to get my water open here. I have not drank enough water today. I'm just looking at my notes here. If I do the chemo the radiation and the encro something, I can't remember what it is, but what it's called. But anyways, it's the estrogen blockers for 5 years. That will reduce my recurrence rate by 70%, putting me at 15% of recurrence rate. So I don't have zero chance of it coming back, but 15%, that's a kind of a small number. So, but that doesn't mean today I'm at 15%. That means I still have to go through all this preventative treatment. So at the end of the 5 years of estrogen blockers, I should be at 15%. So the more I go through this progress, the closer and closer I get to the 15%. That's how I understand it anyways. There is 2 words that are very similar. One is recurrence and one is reoccurrence. Recurrence, as long as my chemo brain isn't getting me mixed up on this, so if it doesn't seem right to you, Google it and fact check for me. Recurrence, I'm pretty sure I'm right, but recurrence means the same cancer coming back. Reoccurrence would be another type of cancer happening. So it would be either a totally different type of breast cancer or cancer somewhere else in the body. We did not discuss reoccurrence. I forgot. Maybe I'll put it in I should have wrote a note when these things were going through my mind. But it's been busy and I forgot. But that should go on my notes for the next time I talk to her. But I won't be talking to her until my oncologist that oversees all of it, until after I'm done my radiation. And that's when we'll talk about the estrogen blockers. One question that I had, and I talked to a number of different medical team people, so the doctors and the nurses and stuff, was what stage am I at? I knew I wasn't stage 4. All they could tell me is it was considered early stage. I also knew it wasn't stage 1 because a tumor above 2 centimeters automatically puts you past stage 1. My phone's ringing. Hold on. Sorry about that. I had a call come in. It's been a busy day, so we had pizza delivered. It was really good, actually. We got a gluten-free with vegan cheese. It had a bunch of good toppings on it. It was actually really good for a unusual type of pizza. But I ordered salad, a big tossed salad for us, and I went through the dip or the dressing options trying to find something that was vegan. And I thought I ordered garlic honey, and it showed up it was hot honey, and I had already poured it on my salad. And hot stuff with these mouth sores, it's not good, so I couldn't eat my salad. Troy managed to eat all his. We shared a big salad. And because he said he was full by the time I said I couldn't eat it, but I said he shouldn't eat mine anyways because I was stabbing at it with my fork, and I just did chemo yesterday, and we're not really supposed to be sharing body fluids right now, but he also said really that little teeny bit, it probably wouldn't hurt him. We're pretty careful all the time. And I did talk to my nurse yesterday about it, and she said it's more of a concern for chronic patients. She was telling me about, she doesn't ever use names or anything, but she says she has a patient, and I can't remember, she's been on chemo pills for like 7 or 9 years or something like that. So she takes them every single day. So the chemo's in her body every single day. So her and her husband, or is it vice versa? It's him and his wife. I don't recall. They definitely have to use precautions all the time and not hug if someone's sweaty or different stuff like that. But my chemo is only really, it's pretty much flushed out of my body after 72 hours. So after that, there's such a small, minuscule amount coming out that during those times, if we hug and whatever, it's minimal. But I don't know, it's 4 months. We've been together for 30 plus years. In the big picture, 4 months of minimal touching is barely a blink. So we're just getting through and making sure that Troy doesn't get exposed to this toxic medicine that he doesn't need. So, I think I was talking about stage when I got interrupted there with our supper. It was a good supper, although it was hot. So I talked about stage 1 being the tumor being under 2 centimeters. Between over 2 and under 5 would put you, I believe, in stage 2 or 3. Stage 2A is no lymph node involvement. Stage 2 would be, I think, like 1 to 3 lymph node involvement. And I can't remember what puts you into stage 3, but I am at stage 2A, so that is very good. The other thing I asked her is if I would need a PET scan. That seems to be a question that I've been getting asked a lot lately from people that care about my situation. And at this time, there's no need for it because the cancer was only in my breast. It hadn't spread to my lymph nodes. There's no need for a PET scan to scan my whole body and get all the extra radiation or whatever in there for something that there's no sign of cancer anywhere else, at least at this time. Hopefully that never changes and won't ever need one, but the scan that they'll do right before my radiation will do the whole area where the tumor is, and I don't know if they'll do in my auxiliary, my armpit area and down my side and stuff. I assume they will do kind of a big range right there to make sure that they get everything. But yeah, I don't know, there's lots of good news in there and some other that's just, it is what it is. But I was pretty happy with the good prognosis. I think it's great. When I say that, I didn't mention this part. When we talked about the recurrence percent, that would be over 10 years. And I think that simply is because this treatment, from surgery to chemo to radiation to 5 years of hormone blocker, estrogen blocker, that'll be 6 years of treatment. So they can't really give me a recurrence rate for 5 years if I'm not done all the treatment. So they base it over the next option of 10-year. So I don't know, that I'm happy with it all. I think that's a good prognosis. Lots of good to come. I just gotta get through all the rest of the chemo, and we'll see how I'm feeling during the radiation. And if I'm not feeling that great, I will just rest as needed and do what I need to get through all that. And when I get to the point that I'm feeling better, I just need to get moving more. And I definitely won't be moving more if my feet are hurting like this. I do have an electric bike, and that is something that I've been really wanting to go ride, but I have some other issues that are preventing me from riding the bike right now. So hopefully I will get that all fixed up so that I can sit comfortably on it and get some exercise that way. The great thing about the e-bike is I still have to pedal, but I can turn up how much electric power it has. So if I only have the energy to fake pedal, then the bike will continue even when I have nothing in me to pedal. I can just drive it like a motorbike, I guess. I think I have to pedal to get it moving at first. I don't know if I can just use the throttle. I haven't ridden it since last year. It's a pretty heavy bike, so to ride it without the electric component on takes a lot of energy, and I don't know if I would ever do that, but I can lower it to minimal assist, and then I have to pedal a lot. So there's lots of variation in there, and that's a great way to start building up a person's fitness level. And riding a bike outside in the nice, beautiful, fresh air and nice surrounding, it's always puts a person in a good mood. Yeah, so that's what I'm looking forward to. This, I don't know how long this video is because I've had so many pauses in it, but I will sign off here for tonight, and I'm going to continue to celebrate the small little wins and good news and all that good stuff from today. And I hope that I have a really good sleep tonight because I really need it. But I hope you guys all have a great night too. All right, bye. Take care, everyone. Talk again soon.